Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this session, I will be discussing this very important topic in vasculitis, that is the Churg-Strauss syndrome. Churg-Strauss syndrome, it is an example of small vessel vasculitis. Right, it is an example of the small vessel vasculitis. And what is another name of the Churg-Strauss syndrome? So, eosinophilic granulomatosis with polyangiitis. This is previously called as the Churg-Strauss syndrome, right? Eosinophilic granulomatosis with polyangiitis. Previously called as the Churg-Strauss syndrome. And let me tell you, it is an ANCA associated vasculitis. Right, it is an ANCA associated vasculitis. And the type of inflammation that you will have is the granulomatous inflammation. Right, the type of inflammation that you will have in case of the eosinophilic granulomatosis with polyangiitis is the granulomatous inflammation. Okay, right. And as already I have mentioned that it is a small vessel vasculitis. And what are the examples of the small vessel vasculitis apart from Churg-Strauss syndrome? And you should know that in small vessel vasculitis, there will be inflammation of arterioles, inflammation of venules, inflammation of capillaries. And other examples of small vessel vasculitis apart from Churg-Strauss syndrome, it includes microscopic polyangiitis, then Wegener's granulomatosis, right? Then followed by that, the next very important type of the small vessel vasculitis is the Henon-Schollen's purpura. Henon-Schollen's purpura, it is the most common type of vasculitis in children, right? And what is the type of vasculitis or what is the type of inflammation in Churg-Strauss? Just now we have discussed that it is the granulomatous inflammation. So, in this granulomatous inflammation of the Churg-Strauss, there is infiltration of the giant cells. Right, there is infiltration of the giant cells, right, and infiltration of the eosinophils. Okay, so granulomatous inflammation means you have the presence of the giant cells. Okay, next, and it is ANCA associated. And what is the type of ANCA that is present in case of Churg-Strauss? It is P-ANCA. So the word P-ANCA, it stands for perinuclear anti-neutrophilic cytoplasmic antibody, right? That is what you mean by the word P-ANCA. And what is the mean age of presentation of the Churg-Strauss syndrome? Mean age of presentation of Churg-Strauss syndrome is around 48 years. And the disease can be seen at any age with possible exception of infants, right? Right, with possible exception of infants. Okay, and if you take female to male ratio is around 1.2:1. In the sense, it is more common in females. Right, it is more common in females. Which one? The Churg-Strauss syndrome. Right, and it is ANCA associated vasculitis. What is that? P-ANCA. Whereas you take C-ANCA, it is positive in case of the Wegener's granulomatosis, right? Now, as you observe in all forms of vasculitis, even in patients with Churg-Strauss syndrome also, you have the presence of the constitutional symptoms. And these constitutional symptoms include fever, malaise, anorexia. Anorexia means loss of appetite, and there can be also development of the weight loss. Now, what is the most common clinical manifestation in patients with the Churg-Strauss syndrome? Most common manifestation in patients with Churg-Strauss syndrome is the development of bronchial asthma. Right, development of the bronchial asthma. That is the most common manifestation, right? And in these individuals, you have the presence of the pulmonary infiltrates. So pulmonary infiltrates, right? Pulmonary infiltrates, they dominate the clinical picture in patients with the Churg-Strauss syndrome. And along with that, the another important upper respiratory tract involvement in patients with the Churg-Strauss syndrome will be development or presence of the allergic rhinitis. Allergic rhinitis and sinusitis. Right? Allergic rhinitis and sinusitis, it may be seen in almost 61% of patients. Right? That is the most common clinical feature. Which one? The bronchial asthma. And you have the pulmonary infiltrates that dominates the clinical picture. Now, what is the second most common manifestation? Second most common manifestation is mononeuritis multiplex. So this mononeuritis multiplex, this is seen in almost, right? This is seen in almost 72% of patients. Now, at the same time, you should also know what is mononeuritis multiplex. This mononeuritis multiplex, which is also known as mononeuropathy multiplex or multifocal neuropathy. So basically, this mononeuritis multiplex, it is a type of the peripheral neuropathy. Right, it is a type of the peripheral neuropathy. And what is the other names of this mononeuritis multiplex? It is also called mononeuropathy multiplex. Right, or it is also called multifocal neuropathy. Right, so these are the other names of the mononeuritis multiplex. So what exactly happens in this mononeuritis multiplex? There is damage to two or more different nerve areas. So there is damage to more than or equal to two different nerve areas. Right? That is the second most common clinical feature. That is your mononeuritis multiplex. Then, what are the other manifestations? That is, there is involvement of the skin as well. Skin lesions that will be in the form of purpura. Right? So you can observe that this is your purpura. Skin lesions such as purpura and skin nodules. Right? Skin lesions such as purpura and skin nodules are very common. Now, you take the eosinophils. I have said you that in patients with the Churg-Strauss syndrome, there is marked eosinophilia. Right? There is marked eosinophilia. And this marked eosinophilia, it is present in the peripheral and as well as the tissue eosinophilia. Right, peripheral and tissue eosinophilia, right? Eosinophil levels are elevated. Next, and let me tell you, it is a granulomatous inflammation, right? So in these patients with the Churg-Strauss syndrome, you also have the presence of extravascular granuloma formation, right? This extravascular granuloma formation, it is a typical feature of the Churg-Strauss syndrome. And apart from that, intravascular granuloma may also be seen. So, most common feature is bronchial asthma. Second most common feature is mononeuritis multiplex, right? And skin manifestation will be in the form of purpura, right? And there is also involvement of the heart and even the kidney involvement. But kidney involvement, it is less common, and it is renal failure is very rare, right? Renal failure is very rare. So these are the clinical manifestations. So this table tells you the summary of manifestations of the Churg-Strauss, out of which the most common is bronchial asthma. Second most common is the mononeuritis multiplex. Now, what are the characteristic laboratory features? First and foremost, striking eosinophilia. So these eosinophil levels, it will be more than 1000 cells, right? More than 1000 cells per microliter. And this new eosinophils, more than 1000 cells per microliter, it is seen in more than 80% of patients. Right? It is seen in almost 80% of patients. And next, evidence of inflammation. Right? Evidence of inflammation. So, if you see this evidence of inflammation, there will be raised ESR, right? There will be raised fibrinogen, okay, and there will be also elevated alpha 2 globulin, right? There will be elevated or increased alpha 2 globulin, and we have discussed that this is an ANCA positive vasculitis, right? It is an ANCA positive vasculitis. And what ANCA is that? That is P-ANCA, right? P-ANCA. And this particular P-ANCA, it is usually directed against myeloperoxidase. Right? Directed against myeloperoxidase. Okay. And what is that? It is anti-myeloperoxidase. Right? It is anti-myeloperoxidase. So this will be a characteristic laboratory features in patients with the Churg-Strauss syndrome. Right? And how do you treat these patients? So let me tell you the corticosteroids. Right? Corticosteroids, they remain first line treatment. Right? They remain first line treatment. And these corticosteroids, they should be combined with azathioprine and methotrexate. Right? They should be combined with azathioprine and methotrexate. So this azathioprine and methotrexate, they demonstrate the efficacy for mild to moderate disease. Right? So corticosteroids, when you combine with azathioprine and methotrexate, right, it is very good, or the efficacy is good for mild to moderate disease. Right, for mild to moderate disease. Then apart from that, we have another FDA approved drug for the treatment of this Churg-Strauss syndrome, that is Mepolizumab. Right, Mepolizumab, it is an interleukin 5 inhibitor. Right, it is an interleukin 5 inhibitor. Which one? The Mepolizumab. Right, and this Mepolizumab, it is not being studied for severe life-threatening vasculitis disease. But in mild to moderate disease, this Mepolizumab is very much efficacious. And in case of severe Churg-Strauss syndrome, the drug that is very much effective is cyclophosphamide. Right, the drug which is very much effective is cyclophosphamide. So that is the treatment for the Churg-Strauss syndrome. Drug of choice or the first line drugs will be corticosteroids, and that has to be combined with azathioprine and as well as the methotrexate. That is in case of mild to moderate diseases. And we have a new drug that is Mepolizumab. It is an interleukin 5 inhibitor that also can be given for mild to moderate disease. And in severe cases of Churg-Strauss syndrome, the cyclophosphamide is being given. So to summarize Churg-Strauss syndrome, constitutional symptoms, right, they include malaise, fever, sweat, headache, and weight loss, fatigue. And the most common symptom will be the bronchial asthma. Second most common will be mononeuritis multiplex. And cardiac involvement will be there, and that is in the form of the congestive heart failure. Skin involvement will be there, that is in the form of palpable purpura. And kidney involvement, very rare, but that will be in the form of pauci-immune glomerulonephritis, and it is less aggressive, right? And joint involvement, that is pauci or polyarthritis, and it is usually migratory arthritis. And nose and paranasal sinuses, right? Surprisingly, high number of patients, they give the history of nasal polyps or allergic rhinitis, right? And manifestations in the ear, that is conductive hearing loss. And why is this conductive hearing loss? Because there will be accumulation of the external auditory meatus with the eosinophilic granulation tissue, and that is what is responsible for conductive hearing loss. And most common symptom, what did I tell you? That is bronchial asthma, right? So the important point about this asthma is that it improves considerably when vasculitis phase of Churg-Strauss syndrome begins. Okay, so this is about the symptomatology in patients with the Churg-Strauss syndrome. Then, if you take the diagnosis, what is the sine qua non of Churg-Strauss? There should be eosinophilia, right? These eosinophil counts are usually sensitive markers of the disease flares, but they respond very quickly within 24 hours to the treatment of high doses of glucocorticoids. So eosinophil levels will be very high, but whenever you give glucocorticoids within 24 hours, the eosinophil, they come back to normal. And even IgE levels, they are elevated, and it is P-ANCA positive, right? And chest x-ray, it will show you the presence of pulmonary infiltrates. Chest x-ray, it will show you the presence of pulmonary infiltrates. And striking feature of or striking character of these infiltrates are their non-fixed nature. They are not fixed. And these infiltrates, they are migratory or transitory in the chest x-ray, right? So this is about the way how you have to diagnose. So to summarize, Churg-Strauss syndrome, it is a small vessel vasculitis. Occasionally it can be medium vessel vasculitis, and it is having eosinophil rich granulomatous inflammation involving the respiratory tract, because of which there is asthma and as well as the blood eosinophilia. And the first line treatment will be corticosteroids. And in severe forms, cyclophosphamide should be given. So this completes the discussion of this very important topic, that is Churg-Strauss syndrome, which is a small vessel vasculitis. Thank you very much.